and she has co-authored and chaired a report on the impact of COVID-19 on BAME people for the Royal College of Psychiatrists. So, Ananta, I'm going to ask you to have your discourse, please, with Sadhguru.
Thank you, JS, for that very generous introduction. And namaskaram, Sadhguru Garu. It is a real...
Oh, Telugu ma meeru?
Aunandi.
Sir.
So it's a real privilege and honor to be able to have this conversation with you today and along with my colleagues. And I've been fascinated by what's happened so far, and I'm really looking forward to the rest of the session. I mean, a couple of thoughts just on what's been discussed so far. And while you've put it in a very articulate way about how we've not really used the main instrument that we've been given, the engine of our lives, in a very useful way. One of the things that I find about the pandemic, and I've worked in both India before, and in the UK as well, and just having observed how things are, one of the perhaps the positive fallouts of what has been a very devastating pandemic is that people perhaps are more willing or less afraid to express their vulnerability. They're at least able to say, look, I'm not quite sure what I'm doing, and maybe I need to restart and reset. And I think that's a positive thing. I think that being able to show that rather than sort of trying to pretend everything is okay and that you're, master of everything is something positive, I think. So that's something that I wanted to share. And the other thing I wanted to say before I asked my question is, you talked about, how people might think of themselves as mentally ill, or how after a particular point is crossed, that anybody can actually reach that state. But over the years, I've seen that there are many people in the world who suffer from mental illnesses where that has not been recognized, and the stigma and the secrecy that surrounds mental illness has actually devastated lives. And I think it is good, although we are not there completely, it's good that that is being validated, the distress, the mental distress, whether it is at the pre-pathological stage or whether it is at the stage where it reaches the diagnosis of mental illness. I think that more and more of that is being validated, which I think is positive. So these are some of my observations based on what you've said. Now, being a child and adolescent psychiatrist, my question to you, or the thing that I was interested in, is discussing a bit more about the effect of the pandemic on children and young people. My experience is more in the UK because that's where I've been for the last 25 years. But I think this holds true to children and young people around the world, is that the different groups of people have had the pandemic impact them in different ways. But for children and young people, when they're at a very crucial period of their development, their emotional, cognitive development, their independence, the pandemic has really made them sort of have to rethink about perhaps their perspective on life or the way they are developing. So whether it is the fact that they've had to stop their interactions with peers, education came to a standstill, that the social media being the main medium by which they interact with peers, or whether it is seeing grief and loss amidst them, although they themselves might not become seriously ill with COVID. They've seen their parents, grandparents, their loved ones dying with COVID. In the UK, we know that in terms of unemployment, it is the 16 to 24-year age group which has been the most heavily affected. We know that in the UK, compared to in all the countries in Europe, for example, the level of stress and anxiety felt by young people is very high. So clearly, there has been a particular impact on children and young people. And what I wanted to ask you was, what insights can you offer us about how young people can regain a sense of connection to life and hope and aspiration amidst all the suffering and the stalling of things that they have taken for granted and are normal? Thank you.
Now, when you say a child or a youth, what it is supposed to mean fundamentally is they're still unformed in some way. But unfortunately, in the present generation, even very young people are too highly formed. if you get formed too early, you become deformed in some way. I'm sorry I'm using such words, but if you take a form very early in your life, that form becomes your way. That is a kind of deformation of life. You should never get formed if you ask me. You must continue to evolve and, reinvent yourself all the time. But these days, because of the level of communication and exposure that they have very early on, the kind of exposure that we would get when we were 25, today a 10-year-old boy or girl is getting that level of exposure, all right, to almost everything. So because of that, very early on they're forming themselves into personalities, strong personalities, which will definitely bring various kinds of problems, pandemic or no pandemic. Pandemic is exposing that. About, your work involves about doctor suicide and things, I was just amazed. About 2 years ago or 3 years ago, I was at the Yale Medical University, and they were telling me the numbers. I don't remember the numbers. In that calendar year, how many medical students commit suicide in United States? It is shocking. People who are investing their lives to make the world healthy in some way, if they are distressed and that they have to kill themselves in school, I'm saying, in an educational institution, well, you can imagine what we're doing to ourselves. And of course, we've been working with various aspects in India. The number of children committing suicide between the age of 12 and 18, in the year 2018, it was around 18,600 children killed themselves. Out of this, 7,300 or 400 of them were below 15 years of age. A 12, 13-year-old child, where is the question of killing myself, You should be exuberant and bursting with life. But that is going away. This is something, if we don't watch this now, if we don't really take care of this now as a generation, as a individual societies, or the price that we will pay will be extremely big. And as your statistics in UK also showing between 16 to 24, the level of propensity to cause damage to themselves, to physically harm themselves is increasing. Physical harm is a suicide in installments, all right? You want to kill yourself, instead you don't have the determination to go all the way, so you're causing harm to yourself, creating pain, creating damage to the body. You're trying to do it in installments. Well, all this is happening. I feel it's not pandemic. I strongly see that it is not the pandemic which is causing this mental distress. Pandemic is exposing people. Change in situations is exposing. But if you look at the mental pandemic, I know you said it in eloquent words of how it's causing suffering. If unfortunately over 1 million people have lost their lives, many have lost their dear ones, many have lost livelihoods. Yes, all these things are things to be compassionate about. But we must understand, compared to what previous generations have faced. For example, you're in London, is it, Ananta?
I'm actually near Birmingham.
Okay. Even Birmingham was bombed in World War II, but London was flattened, all right? Leave the other people, I'm just talking about the English people. What they've gone through, the previous generation, compared to that, this pandemic is a softball. You must hit it right. I'm saying compared to wars, famines and natural calamities of great disaster, this is a very soft ball. With responsible, conscious behavior, we can deal with this. But because we have become such compulsive creatures of habits, that now if you have to just change some little thing, you suffer so much. Right now, going to work, everybody was complaining, this commuting is such a nuisance, getting onto the train, going there, see how people are standing in the trains like they're cattle going for slaughter. They're going to work. You look at the expressions on people. Now you don't have to go to work, you can work from home. Now this is great misery. So we must understand, we are not able to handle any change